I lived in the UK for 5 years, during which time my family and myself all had healthcare on the NHS. Nobody had to check our insurance before they could even see us. We simply made our appointment, we went to the doctor, we received our care. That was it. In the US, being sick meant that we had crippling medical debt. We were considering filing bankruptcy. We had no consumer debt, only medical debt. In the UK, that was not a problem. I have myalgic encephalomyelitis chronic fatigue syndrome, or ME/CFS for short, which means the more I do, the worse I feel. Because of ME/CFS, I'm currently unable to work and I'm only able to leave my home a couple of times a month. I'm primarily housebound and bedbound. We only moved back to the United States because the Affordable Care Act came into effect. Yet we're still here 4 years later with the same situation. We have maxed out our credit cards because of medical expenses. We have to decide whether to go to the doctor or ration my medications or buy food. And this isn't hyperbole, this is something that just happened. This was a discussion that we had this morning. I support Medicare for all because healthcare is a human right. I think that people get scared, and I understand that fear.
If Canada can provide healthcare to all people, the UK can provide healthcare to all people, every major country on earth can provide healthcare to all people. I don't think it's that scary.
I want to tell them that they don't need to be afraid, that my experience with universal healthcare has just been overwhelmingly positive, and there was not one aspect of my life that it did not make better.